Okay. Can you hear me? Hope you can hear me. Dr. Carissa Etienne, Director General of PAHO. Dr. Noreen Jack, Country Rep, PAHO. Other distinguished ladies and gentlemen in the audience. Ladies and gentlemen, let me wish you a good evening. It is a great pleasure for me to welcome everyone and to welcome especially our guest speaker to our 25th Sir Kenneth Standard Lecture. Can't believe time has gone so quickly. We moved into this building in 2012, and the first lecture in this building was the Sir Kenneth Standard Lecture given by our Chancellor. So today we're going to have Dr. Etienne giving the 25th lecture, and so she's in very good company. Our conference has been going on now 25 years and has been a great success. I'm pleased to see so many people in the audience, and I hope that all of you will come back tomorrow and then on Thursday for the workshops. Please come tomorrow, especially when we have our lectures, because it is usually quite special to hear from the different faculty members, students, postgraduate students, and I know we have a treat in store for you. We had our ethics seminar on Sunday, and that was very interesting as well. A lot of very interesting topics. But today is the Sir Kenneth Standard Lecture. I don't know if everybody in here, if you all know about Sir Kenneth Standard, you certainly learn more about Sir Kenneth Standard today. And his daughter is here, Dr. Eileen Standard Golson. And we thank her for allowing us to use his memory to have this lecture. So before we go any further, I'm going to ask some FMS students to sing the national anthem of Jamaica. And you can join them. And you can hum along with them.
Eternal Father, bless our land, guide us with thy mighty hand, keep us free from evil
Thank you so much. That was a wonderful rendition. I, I don't know if you realize that Mr. Halliburton is listening to you carefully and he's recruiting students to come and sing. So he has heard you, and so look out for him afterwards. We're still waiting on the principal, but in the meantime, I will give a few opening remarks. So, ladies and gentlemen, let me welcome you to our 25th annual research conference. This is our opening ceremony, and traditionally, this is when we give or listen to the Sir Kenneth Standard Lecture. The conference theme this year, very relevant and topical. This year, the theme is One Health, One Caribbean. And we will be zooming in on topics in particular that affect the environment, climate, and occupation, among several other things. Global warming and its effects are matters of great significance, as a change in climate means a change in so many things. And earlier this year, we heard a brilliant lecture given by Professor Taylor from physics, 1 degree too many. It's amazing that we don't recognize that a 1 degree change can cause such a significant impact on the environment. And so we're having slight changes in the temperatures, and this has affected so many things, including erosion, rainfall, hurricanes. Everything is affected by these slight changes. Many people, when they hear about global warming, trivialize the issue, but I can assure you that it is not a trivial topic. I have taken, well, one of my pet peeves is people who don't respect the environment. And I get very annoyed when I see people, especially those who should know better, let's call them university students, who have little or no knowledge of their immediate environment, and they have no clue of the impact that it has, not only on them, but on their neighbors, the other constituents. But during the three days of this FMS conference, we'll probe into many of these issues and explore the wider implications for the Caribbean. Our researchers of all ages will educate us on these matters, as well as learn themselves from each other. And this is an excellent way of exposing the talent that we have, and hope that they can find useful linkages with others, not only from UWI, but from across the globe. We'll be having visitors who will be listening to some of these lectures, and hopefully some of you will be identified. I must extend a particularly warm welcome back to Dr. Etienne. Dr. Etienne was a student here in the 1970s. I think she graduated in 1976. I remember her as a student, and she hails from Dominica. Dominica is a small country, 70,000 people, but it has produced one of the gems of the Caribbean, one of the persons that we're most proud of. She has risen from medical student SMO. She has been Assistant Director, General Health Systems of WHO, World Health Organization. And now she's the Director General of PAHO. Only one other medical student from this university has become Director General of PAHO, and that is Sir George Aline, our Chancellor. So Dr. Etienne has followed in his footsteps, and Dr. Etienne, I don't know if you realize that our Chancellor is stepping down. So who knows, you might become the first female Chancellor from the Caribbean. The first Chancellor was from the US, of course, from the UK, of course. So welcome, Dr. Etienne. We look forward to listening to you. I think Dr. Etienne came here once before. I don't know if at that time she was Director General of PAHO, but we've listened to her. And we're here again to listen to some wonderful words from her. She's a wonderful choice of speaker, having so much experience in the field of public health. And during her tenure, many things have happened, including the eradication of measles in the Americas. That's a big deal. I'm happy to see an almost full room. I'm hoping that for the rest of our conference, we will have an overflowing room. So please tell all your colleagues and friends about this conference, and we look forward to educating you and learning from you over the next 3 days or 2 days. I certainly hope at the end of this conference that you would have said that it was well worth it. So thank you, ladies and gentlemen. Our Professor Archibald MacDonald is not here yet. So I think at this point we should ask the university singers to come and do their item. Are they inside? Let me ask university singers to do a filler until we get Professor MacDonald. They are quite busy nowadays, as you must recognize. The Vice Chancellor himself actually went before the Public Accounts Committee today, this morning. So let's hear from the university singers.
Present where this time the day when the road seems rough, when you're born enough. Don't faint, don't sigh, don't cry, wonder why. Just keep on trying. Cease your sighing. Look beyond the present way. This time will pass. Tomorrow's a brighter day. Looking around, there's a whole new world I see, and so many things that I can do with your strength in me. Now I ask you to hear. Now I ask as I sing of brighter days. For I need to hold you very near. Come and find the way. Give me the wings of an eagle. I will soar into the sky. Give me strength to hold your brother's hand as he's passing by. Give me the eyes of tomorrow. Let me there a place for a hopeless sinner who has hurt all mankind just to save his own soul? One love, one heart, let's get together and feel alright. One love, one heart, give thanks and praise to the Lord, and I will feel alright. Let's get together and feel alright. Let's get together to fight this holy Armageddon.
One love.
So when the man comes, there will be no doom.
One heart.
Have pity on those whose stances grow thinner. There ain't no hiding place from the Father of creation. One love, one heart, let's get together and feel alright. One love, one heart, give thanks and praise to the Lord, and I will feel alright. Let's get together and feel alright. Give thanks and praise to the Lord, and I will feel alright. Let's get together and feel alright.
Thanks so much to the university singers. Excellent rendition, as expected. And I'm only sorry that when I was a younger person, I could sing. I couldn't sing. I'm not sure if Mrs. Reed is here, Mrs. Stephanie Reed, on behalf of the minister. She's not here. But I'm going to ask Professor Denise Elmer Shearer to come and bring greetings on behalf of the PVC for research.
Thank you, Dean. Dr. Etienne, Dr. Jack, ladies and gentlemen. PVC Weber, who would usually be with us, is actually in Belize doing something else at this point in time, although we have been on WhatsApp. As most of us are used to PVC now from the point of view of graduate studies, but last year the research portfolio was assigned to him. And he is responsible for driving it from the center across the campuses. One of the things that he has spoken to the deans about, and is certainly reflected in your program, is the importance of research contributing to national development and also being focused on the Sustainable Development Goals. He has come up with input from your faculty, from all faculties, with our research objectives for the campus, which we are looking at. Interestingly, this morning, I also went with Professor Hall, Sir Kenneth Hall, on his behalf, to the PSOJ to look at ways that we can work in our faculty and across the faculties, because clearly I stand here representing all faculties now. Sometimes I forget that I'm not FMS. And when you put me in a room that is FMS, I revert to being purely FMS, and no apologies there. But it's about looking at the economic development. The Prime Minister and others signed the new economic drivers. And it's very interesting when you look at it. I gather it came out a month ago. I don't even remember seeing it in the Gleaner, but now have a copy. But there's so much in it for us as a faculty because it talks about labour force. It talks a lot about the health requirements. It talks about meeting the health needs. And then it talks, and it has a section on the non-communicable diseases. So just on behalf of PVC to congratulate the faculty on remaining in the vanguard of research on the campus. He did, however, make one point that I was to urge you to increase the documentation and the publication from the research. Dean, he points out that where medical faculty leads, so does the university. And if medical faculty drops in any way, so does the university. He's concerned that we've gone down a little bit in the per capita publications and urges us to ensure that we convert these abstracts. Let me remind our academics who are full-time members that R&P, Research and Publication Grants, is available for help with some of the fees for publication. You can also get them from your study and travel grant, because some of these publication fees for the high-impact journals are prohibitive, especially to our younger researchers. So let me remind you that we do have some things, clearly not adequate, but they're there for you to utilize. Congratulations, Dean, congratulations to your faculty, and we in Grad Studies and Research look forward to trying to help convert some of these.
Thank you, Prof. We all know the importance of research, and we keep talking about it every day, research, and publication. But also important is scholarship. And when I say scholarships, or I should say scholarships, scholarships to students to allow those that are less well off to be able to go through university, get a university degree. Some of the students are going to be the first ones from their families to come to university. So we welcome scholarships from anyone, and today we're going to be talking about the Vernon L. Halawani Scholarship, and I'll ask Professor Abel to come up and say a few words.
Good evening, everyone. I'll just comment briefly on this scholarship that the Vernon and Halawani Scholarship Trust is a trust that was established in honor of the Vernon and Halawani families. The families have over the years made a consistent, and I'm told substantial, probably highly substantial contribution to a student pursuing the Masters in Public Health. Unfortunately, I hear sounds as if you're saying, why not us? Well, I suppose the key to that is to, enroll in the Masters in Public Health program. But unfortunately this year, there will be no award. And nonetheless, would like to acknowledge the contribution made by the family, and we trust that they will continue to do so in the future. Thank you.
Thank you. Perfect timing. Here comes Mrs. Reed. So, Mrs. Reed, I'm going to let you just put your bag down, get your notes together. And just tell us when you are ready. Mrs. Reed is going to be speaking to us on behalf of the Minister of Health of Jamaica. So welcome, Mrs. Reed. You're not quite ready? All right. So Mrs. Reed is well known to us. She worked here at the hospital some time ago, and now she works quite closely with the Minister of Health, a very experienced administrator in health, and I'm sure she's going to bring some gems to us. You want us to see the video first? All right, so while Mrs. Reed gets her presentation ready, we're going to be doing a short video on Sir Kenneth Standard's awardee. Sir Kenneth Standard awardee. Who was chosen? Which one is it? All right, so every year we give the Sir Kenneth Standard awardee to a public health individual. This year there were 7 people shortlisted from across the country. Those shortlisted: Malvia Williams from St. Thomas, Yvette Turner from Portland, Albert Brown from St. Mary, Joel Myers from Manchester, Mr. Beverton Roy from St. Elizabeth, George Slowly from Southern Regional Health Authority, and the winner was Miss Karen Brown from the Northern Regional Health Authority. So these are public health workers who have been outstanding in the field, and so we have an award for Miss Brown. Now, if you remember, Sir Kenneth Standard started out in one of the first classes in medical school here. I think he was in the first class, if I'm not recall. But he was our first professor of public health, having left here and studied at the London School of Tropical Medicine and Hygiene. And he championed the cause of public health for many years in the department, started the Department of Community Health and Community Health, but later joined to psychiatry. And we, in memory of all the good work that he did here and also in Barbados, we award the scholarships. Can we get the awardee, Miss Brown, to come forward? Is she here? Okay, Miss Brown. Miss Brown, they're asking you to just sit so we can show the video first, and then you come forward. So you can have a seat.
Public health inspector. I've been a public health inspector for the past 24 years. Well, I've known Miss Brown for quite a while, quite some time. When I just started public health training, I came into the parish in '97 and she was my supervisor. We did some practicals together and she was very inspirational to us. All the persons who were here indicated that.
Miss Karen Brown is a team player, a real team player. And she makes sure that in her contributions that everybody's take is part of the final paper.
She's a special person, I should say. She exemplifies so much good things, especially in the field of public health. She's hardworking, she's so talented, she's passionate about her work, and she just loves doing her job. She's a community person.
She has gone up with her team in terms of mosquito eradication. She has had the fogging machines that have been donated through us from the Tourism Enhancement Fund. But the schedules that she had placed out made everybody comfortable. She would speak to them about the fact that you might be affected by the fogging. This is the time you're doing the fogging, so that if you need to escape from the air for that time being, then it's done.
Since coming into the parish to work in 2000 after graduating from school, she has been here. She was the only female public health inspector in the parish at the time, and it did not intimidate her, right? She worked along with them. She even overstepped some of the things that the men wouldn't do, and that really caught our attention. Mine, for example. And so because of that, we have always looked at Karen as a role model, especially us, the females, always looked at her as a role model since then. And we have always thought that she was inspirational and she deserved something more than what was offered to her on the local basis.
I was trained at the West Indies School of Public Health, which is located in Slapping Road, which is now the University of Technology, where I acquired a diploma in basic public health inspection. I also did a diploma in meats and other foods, diploma in supervisor management. I subsequently pursued a degree in environmental science, as well as a Master of Public Health with a major in health education and promotion.
Miss Brown has a phenomenal sign-on. When I say a phenomenal sign-on, I really mean that. She's a passionate person in terms of her health field, and she goes beyond the call of duty to make sure that she is actually contributing to the community.
I met Karen actually when I came here on internship in 2001. She was a supervisor, not my supervisor, but she was supervisor for the Ocherias Health District. From then, I had always admired Karen. So from then until now, she has been my mentor, someone that I always look up to. I'm always impressed by how she executes her job.
She motivates the staff. She comes down to our level, right? She doesn't act as if she's up there and she's above everybody else. She comes down to our level. She tends to encourage us to do better, not just to do better, but to improve on our qualifications, right? And that is one thing I really like about her. She's at the health department. She tends, whatever we call upon her to assist us with, she's ready. Even if she don't have the answers, she will try to assist us. She'll make recommendations. If we fall short, she will not tell us, badger us. She'll point out where our shortcomings are and help us to do better.
When I was notified that I had won the award, of course, I was most elated. It was most unexpected, but I really was surprised and elated that I had won. And I'm very happy. I shared the news with my superiors, and they were also overjoyed. Being a part of the team, we worked together over the years, and to achieve this feat, I think everyone found it to be most phenomenal.
Karen is a poet, and I've heard quite a few of her poetry. Her poetry is very inspirational. And around her, put it.
Her proposal in terms of the cleanup for Chickpea, Zikpea has been world class. And based on all of that and her presentations at our different resort board meetings, it was a no-brainer for me to recommend her for the award.
I've never met Kenneth Standard. I understand that he has passed away, but I know that he has been a public health pioneer who has impacted significantly in the development of public health in Jamaica.
Love Fever by Karen Brown. I have got a fever which has made me very weak. It keeps me wide awake when I go to bed to sleep. I have got a fever I want to spread to everyone and cause an epidemic of explosive proportion. The fever I have got is of unlimited degrees. You cannot measure it, being of such high intensity. Chikungunya, no malaria, has never done this to me. The thing has taken over my entire anatomy. I went to see the doctor, who calmly diagnosed there is a rare condition to which you've been exposed. You must not be isolated, nor even quarantined, though your prognosis and perils are clearly to be seen. Indeed, you have low fever, a very rare disease. To know that you're infected, I'm very, very pleased. I want to know your contacts.
Ladies and gentlemen, let's give a hand to Ms. Brown, the poet, agent of change, public health inspector extraordinaire, Ms. Karen Brown. All right, so can we have all the parish winners stand so we can recognize them, please? Those who are here. Let me offer my own personal congratulations to you as well. And thank you very much for all the work that you've been doing in public health. Mrs. Reed? Mrs. Reed is here to say a few words on behalf of the Minister of Health. Sorry, Mrs. Reed. Please come forward and give your remarks.
Professor Fletcher, distinguished guests in the audience, good evening. I must tell you that the Honorable Minister, Dr. Christopher Tufton, could not be here this evening. The circumstances are unavoidable, and you have to contend with me in his place. Congratulations to the Faculty of Medical Sciences for the work that you have been doing over the years. 25 years represents a lot of work. And it also represents the advancement of healthcare in Jamaica and by extension in the Caribbean. Actually, I look at the theme, One Health, One Caribbean. It is timely and appropriate as we forge partnerships with our neighbors to face the issues in our health system, while we confront the challenges of environmental factors that determine how we intervene and plan programs to manage diseases. And as you know, we have been faced with new diseases that have emerged and those diseases that have re-emerged. And so the challenges continue. In all of this, the ultimate aim is to provide the best care and services to our people. At the heart of all this, our countries have to ensure that our healthcare systems can achieve the highest healthcare goals. And in our commitment, we have to ensure that we are very serious about research. It is through this commitment to research that we're able to be provided with the evidence that is necessary to inform health policy and ensure that health providers can improve in terms of healthcare practices. It is very good to see the sort of collaboration that takes place. You're here this afternoon and you're celebrating public health professionals. It tells us that in the field of health, all professionals have to work together, have to bring to the table their perspectives. And a huge part of this is the studies that have been done at all levels that provides information that assists you in changing things, in coming up with new ways of controlling diseases, managing diseases, and provide care for our people. There's recognition that singly no country will successfully overcome the threat of diseases and manage health problems on their own due to the lack of resources. The need to create a shared vision around one purpose, and in so doing, utilize our limited resources in areas with the highest social return, and guide resource allocations to address issues of inequity in health is of paramount importance. The focus on health for the Caribbean as a nation, one nation, has been recognized by our leaders. Not only has it been recognized, it has been understood and appreciated by our policymakers. And this was played out at the Nassau Declaration in 2001, where heads of government of CARICOM championed the importance of a regional approach to evidence-based decision-making. Sorry about that. Evidence-based decision-making for health policies, programs, and practices in the Caribbean. As a nation, our health systems must be informed by the best scientific knowledge and the best approaches to deliver healthcare and services. With this in mind, ladies and gentlemen, we salute the Faculty of Medical Sciences for blazing the trail in medical research and establishing a vehicle such as your annual conference to expose the work that you have been doing and being the catalyst to encourage and drive research in different areas, clinical research, biomedical research, health systems research, epidemiological studies, and other related studies. This, ladies and gentlemen, is very important to bring to the table critical information to manage diseases and advance the health of Jamaicans and our Caribbean neighbors. This afternoon is just one of the many marks that you have made. I really wish the minister was here to hear Karen and to hear her. I mean, the minister needs to get that poem out there. But on behalf of the minister, I again congratulate you and to let you know that the Ministry of Health is supporting research, very serious about research. And as we move ahead in the future, we can expect great things happening from the Faculty of Medical Sciences. Thank you.
Thank you very much, Mrs. Reed. I'm sure you know that the suggestion that you've just made of shared resources this is how the University of West Indies started many years ago, 1948. Shared resources. We have become a little bit fragmented since, and I understand that we've become even more fragmented. I hear that Antigua wants a university and Bahamas wants a university and so on and so forth. Well, there are many, many universities in the Caribbean now. I think we have about 65 offshore medical schools with 45,000 students. So everybody has a medical school now. But University of West Indies is here trying to hold the flag of the West Indies high and the standards high. And so thank you very much for your words of congratulations. I'm going to ask Dr. Cunningham Myrie, Colette Cunningham Myrie, to come and introduce our Sir Kenneth Standard Distinguished Lecturer.
Ladies and gentlemen, good evening. It is with immense pride that I inform you tonight that history will be made here tonight. It's a bit more pleasant than what some of us woke up to this morning. Some of us. Our speaker will be shattering the proverbial glass ceiling. How? History will record her being the first woman to deliver the Sir Kenneth Standard Distinguished Lecture in the 25-year history of this annual conference. That, I think, is a significant achievement. Please applaud again. Let me tell you a little bit more about her. My dean has said some things, but I think they are worth repeating. She is a medical doctor who commenced her undergraduate medical training in the early 1970s, right here at the UWI Mona campus, alongside classmates such as the Honorable Dr. Horace Chang, Professor Michael Lee, Dr. Lucian Jones, Dr. Alafia Samuels. I could go on and on. Wendell Guthrie, and I'm getting myself in trouble, to name just a few. She graduated only 40 years ago as a member of that great class that was mentioned, the class of 1976, and later went on to obtain the degree of Master of Science in Community Health from the London School of Hygiene and Tropical Medicine, University of London. Her medical career began in the country of her birth, Dominica, as a medical officer at the Princess Margaret Hospital, and eventually she became the chief medical officer. She served her country's health sector in other important roles, but many of her colleagues believe the most significant was as Director of Primary Healthcare Services in the 1980s. It is said she was pivotal in the successful implementation of primary health care in Dominica. In so doing, literally walking the length and breadth of that country and ensuring the development of strong and meaningful relationships among the various disciplines within the health team. That display of commitment and fixity of purpose was certainly pivotal in her elevation to serve at the international level. Firstly, at the Pan American Health Organization as Assistant Director from July 2003 to February 2008, and then at the World Health Organization as Assistant Director General for Health Systems and Services between March 2008 until November 1, 2012. Her current appointment as the Director of PAHO since February 1, 2013 is another stellar achievement. The only female from the Caribbean to have served in this prestigious position. Thank you for that. Let's applaud. She has received numerous awards, prestigious decorations, and honors, including the 2015 Dominica Award of Honor for Public Health and International Affairs, and more recently, the Honorary Doctor of Science degree at the UWI Cave Hill campus graduation held a few weeks ago in Barbados. So why is she our guest speaker, you may be asking? We wanted a distinguished public health leader who was au fait with the One Health Initiative, a strategy that recognizes that the health of humans, animals, and ecosystems are interconnected. We wanted a speaker who has displayed a deep understanding and appreciation of the collaborative and multidisciplinary approach required in public health at all levels. And finally, and most importantly, we wanted a speaker with the competence to address our conference theme, One Health, One Caribbean. Our guest speaker fulfills all these requirements. Her close friends and work colleagues describe her as competent, outspoken, a straight shooter, but most of all, they admire that she has remained down to earth despite her many achievements. Ladies and gentlemen, please join me in welcoming to the podium the Sir Kenneth Standard Distinguished Lecturer, Dr. Carissa Etienne.
Thank you. Colette has made me quite shy now, actually. President, Professor Horace Fletcher, let me also recognize Dr. Denise Eldermeyer, Dr. Noreen Jack, our PAHO WHO representative, the nominees and the awardee, Dr. Stephanie Reed from the representing the Minister of Health. Let me particularly also recognize Dr. Eileen Standard Golson, who is the daughter of our Sir Ken Standard, who is well known to us as Prof. Okay? So let me start by saying certainly a good evening to you all. I feel as if you've been here for so long that you probably don't want to listen to me now. I will try to keep your attention. It is certainly with immense pleasure, but all the same with great humility and an awesome sense of personal responsibility as a daughter of the Caribbean, as an alumna of this medical school, as the director of the Pan American Health Organization, and after all of what Colette has said, that I stand before you this evening to deliver the Sir Kenneth Standard Distinguished Lecture entitled One Health, One Caribbean. One Health has been defined as the collaborative effort of multiple disciplines working locally, nationally, regionally, and globally to attain optimal health for people, animals, and the environment. Tonight, in this expanded context, I will take you way beyond the animal-human interface to encompass many of the issues that confront human beings and also how they interface with their own environment. One Caribbean speaks to how we must see ourselves as a region, working together in harmony to ensure that we are much stronger than the sum of our individual parts. Frankly, I believe that our people have historically perceived themselves as one Caribbean. After the dismantling of the West Indies Federation, we went and we gave birth to CARIFTA in 1963. That was followed by the establishment of the Caribbean Community in 1973. And in 2001, we saw the establishment of the CARICOM Single Market and Economy. We have pursued at the political and at the local and community levels, we have pursued Caribbean integration. I stand here in tribute to Prof. Standard. I describe Prof. Standard as the gentle giant of public health, who was advocating for public health long before it was a sexy topic, no? Yeah, here's a little word there. Yeah. I feel privileged in saying that as my professor, he both taught and inspired me. He was the champion of what was called social and preventive medicine at the time and later became community health. And I need to tell you, nobody liked the S&P flagship. You know? You didn't like when you had to go to S&P. But he was, I think, committed to the expansion of access to healthcare in the Caribbean.
He ushered in the era of community health aides decades before task shifting in health came into vogue. I still remember his community health aid book. He was very encouraging and supportive to my colleagues and I in Dominica during the transformation of our health systems based on primary health care in the 1980s. Indeed, I believe that Sir Kenneth Standard was a Caribbean man that epitomized the rare quality of being a leader who dedicated his life to walking the talk. It is interesting to note that in 1920, when he was born, it was into an era of great public health challenges. In Barbados at the time, infant mortality rates were high, 270 deaths per 1,000 live births. So one in 3 children survived. So we are fortunate that this Caribbean son of the soil survived his birth. Life expectancy at birth in Jamaica then was merely 35 years, a result of high infant mortality, child mortality, and premature adult death. So as a Caribbean people, we have come a long way. Sir Kenneth Standard's journey intersected with the Pan American Health Organization when he was awarded a PAHO WHO fellowship to attend the Graduate School of Public Health at the University of Pittsburgh. This training in public health further equipped him for his life's work. As you are all aware, the Pan American Health Organization was founded in 1902 and is the oldest international public health agency in the world. It works with the member countries to improve the health and the quality of life of the peoples of the Americas, and it also serves as the World Health Organization's regional office for the Americas. In 2002, Sir Kenneth Standard was named a PAHO Public Health Hero on the occasion of the PAHO Centennial celebration. I want to take you briefly on a retrospective view of some aspects of healthcare in the Caribbean that will demonstrate where we've come from, how we've built ourselves into one community for one health, and some of the challenges that we still face. And I will end with a challenge to the University of the West Indies. A retrospective view of some aspects of health in the Caribbean, I think, is necessary to appreciate the evolution of health and healthcare in the Caribbean and the advances which have been realized. Let me begin in the latter portion of the 19th century. Following the lack of access to healthcare for ex-slaves, the colonial government at the time established a healthcare system, which up to this day influences how health and healthcare is organized in the Caribbean. A general hospital for caring for the sick, dispensaries and dispensers, and district medical officers in the rural areas were and constituted the basic structure for delivery of healthcare at the time. The emphasis then was mainly curative, as it is now, mainly curative, and the epidemiological structure was dominated by infectious diseases, many of which were preventable. Professor Carl Theodore, writing an article in the International Journal of Humanities and Social Health Services, reports the introduction of public health programs in the English-speaking Caribbean in the early part of the 20th century. So we saw in Jamaica that a Hookworm Commission was established in 1919, a Bureau of Health Education in 1926, the School of Sanitary Inspectors in 1927, and malaria and TB surveys in 1928. Infant mortality rates at that time were still extremely high, between 100 to 320 per 1,000 live births in the Caribbean, but declining at reasonable rates. Sir Frank Stockdale, in his report of 1940-42, provides an interesting glimpse into organization of health systems in the Caribbean at that time. So health unit systems were established sometime in 1942, and the goal was promoting the health of the whole population while providing adequately for the care of the sick. So you had the typical health unit that was staffed by a medical doctor and had also nurses, inspectors, later nutritionists, and school dental nurses and community health aides. Importantly, many of these professionals were trained either locally or at regional centers, mainly in Jamaica. And they were supported by PAHO fellowships. I think this is important because with this centralized training in one center, it ensured that we had a common vision and common approaches to the issues in the Caribbean, which were virtually the same. If you looked at the epidemiological situation at the time, we were all, and as it is now, we were all facing the same challenges. And I think it's important to note this, that our challenges are the same in the Caribbean as it comes to health. Interestingly, at that time, multi-sectoral collaboration was a driving principle of the health system engagement, as there were programmatic links to social welfare, agriculture, and education to improve the living standards in rural communities. So the multi-sectoral One Health approach to working and engagement has been and is going to be fundamental to the achievement of the 2030 Sustainable Development Agenda. The critical importance of potable water, sanitation, and hygiene to the health and well-being of Caribbean peoples was clearly understood, for as early as in 1962, Jamaica had developed public programs to improve water supplies, to immunize children against communicable diseases, and to improve nutrition. And that was contained in its inaugural 5-year plan for Jamaica. With the advent of independence, and as countries became independent, the Pan American Health Organization established offices in Jamaica, Trinidad, Guyana, Barbados, which later served the Eastern Caribbean islands and British dependent territories. I stand here not merely because I am the director of PAHO, but as a Caribbean person who experienced the work of PAHO. I stand here and say that PAHO has been very instrumental in building solidarity for health in the Caribbean and in ensuring that as a Caribbean that we were able to enunciate policies, to define programs that would best be implemented in and within an integrated approach. PAHO contributed to capacity building. Some of you are young. You heard my age, I graduated 40 years ago. But PAHO at that time provided fellowships for all of the public health professionals that were trained at the time. They built joint programming, planning, and implementation, and they ensured technical assistance and technical cooperation. I believe that this helped to foster a common and shared vision for health in the Caribbean and ensured common approaches to addressing issues of health and, importantly, a sense of accountability. The UWI, University of the West Indies, contributed to this One Caribbean in Health movement by training or supporting the development of health professionals, doctors. Every doctor who was trained in the Caribbean was trained in one place, with one program, one set of exams, and one set of serious professors. But beyond that, the doctors, the nurses, sanitary inspectors, and they were called sanitary inspectors at the time. Later on, who they became known as environmental health inspectors or environmental health officers, nutritionists, family nurse practitioners, public health nurses, health educators were all trained in common training programs. This is a significant contribution to the One Health and One Caribbean approach. It served to unify the thinking and the approaches to health in the Caribbean. There are many successful outcomes of this Caribbean integration movement in health, and I probably will just highlight a few for you. The Caribbean Food and Nutrition Institute. This was inaugurated right here in Jamaica in 1967. It played a major role in improving nutritional status of Caribbean populations. The center, a Caribbean center, was administered by the Pan American Health Organization. Importantly, this center spearheaded the Caribbean-wide action through formulation of national food and nutrition policies, through the training of nutritionists, through the development and standardization of programs, nutrition information, public education, and the monitoring and evaluating of the nutritional status throughout the Caribbean. The CFNI came on stream when we were facing serious nutritional issues of our time. Importantly, CFNI also stimulated and fostered this multi-sectoral action, bringing together health, mainly health, agriculture, education, and other social sectors. I worked very closely with CFNI as a national. Maybe you're too young, but the CFNI had a publication called Cajanus, no? And that came clockwork on time, but provided important information for healthcare workers, but also for the general public. In addition, the excellent research conducted by the Tropical Medicine Research Unit in UWI contributed much to our understanding of marasmus and kwashiorkor and led, in turn, to improve national programs utilizing common approaches and common frameworks. In Barbados, the government-funded National Nutrition Center, established by Sir Frank Ramsey, also worked assiduously to improve the burden of malnutrition and to improve the nutritional status of preschool children. These collective efforts saved millions of lives, particularly the lives of women and children, in the Caribbean, but also beyond the Caribbean. Another example of this successful joint work was the Caribbean Epidemiological Center, which was known by CAREC. CAREC was established in 1975. It was also administered by PAHO. But although they were administered by PAHO, they were Caribbean institutions. And in fact, they were institutions that were linked with CARICOM, but PAHO administered on behalf of CARICOM. Interesting to note, they also benefited from financial contributions, both CFNI and CAREC, financial contributions of member states. CAREC was instrumental in spearheading epidemiology, disease surveillance and response, including laboratory support for the Caribbean as a whole. This Caribbean institution was essential for confronting communicable diseases, providing data and information for decision making. They built capacity and they marshaled the One Caribbean approach. Any island in the Caribbean that faced a disease outbreak, you pick up the phone and you called CAREC, and CAREC was at your doorstep in a day or two. And with the nationals, it organized for the response and implemented that response. But that was underpinned by the capacity building that CAREC gave to many countries. So when the CAREC team arrived at the country level, you were also thinking in the same way with Carrick. And Carrick knew what were the capacities of every country in the region. And so they knew exactly how to respond and what team to bring to any of these events. Another achievement that is notable is the Joint Caribbean Expanded Program for Immunization. That indeed was a trailblazer for the region of the Americas and for the world. This program was coordinated under Carrick-Paho with the support of donors. It mobilized political will of governments, the commitment of healthcare workers, and the community as well to get the job done in the Caribbean. The Caribbean became the first region to eliminate many vaccine-preventable diseases. Smallpox, we were the first region. Poliomyelitis in 1982, that was 12 years before the region of the Americas eliminated polio. Rubella was eliminated in 2001, and congenital rubella syndrome, our last case was 1999. Long before, only last year, in the region, we was certified as being free from congenital rubella and rubella. So some 14 years after the advances in this region. Indigenous measles in the Caribbean was eliminated in 1991, 25 years before the region of the Americas was certified as being free of measles transmission. We have done together excellent work. But remember, this represents 22 years of effort with political commitment, with the coming together of Caribbean islands in solidarity, with the helping of one another. And I didn't tell you, but the Caribbean also instituted what is now known as Immunization Day. We started Immunization Day in the Caribbean. Then the Americas adopted Caribbean Day in the Americas. And then the global level instituted Immunization Day. So we are the precursors of change. And we have been able to be successful because individual countries did not go it alone. Because we came together in solidarity and worked towards our common goals. In the early 1980s, Professor Standard would have also witnessed the emergence of a mysterious new infection, and I am referring to HIV. The second highest prevalence of HIV/AIDS in the world was recorded in the Caribbean, exceeded only by sub-Saharan Africa. It is, I believe, the extraordinary leadership of heads of government of CARICOM, the declaration of the heads in 2001 that HIV and AIDS constituted a regional priority, and the formulation of PANCAP, the Pan-Caribbean AIDS Partnership in CARICOM, that ensured a targeted and focused response across the Caribbean, embracing access to care and prevention and the involvement of all sectors, including civil society. We are at the point where the Caribbean is reporting coverage rates for care and treatment it was 1% in 2000. We are now at 84% of all persons who are diagnosed with HIV are receiving treatment. And 55% of these are virally suppressed, an achievement. Also, stigma and discrimination are reduced. We are at the point now in the Caribbean where most of the countries in the Caribbean have applied to WHO for verification that we have eliminated mother-to-child transmission of HIV. It could not have been done one country at a time, acting not in tandem. It is because of that collective visioning and that collective response that we were able to achieve this. I think also to note that it is through this concerted action that we too eliminated malaria, except for Guyana and Suriname. And at one time, we had eliminated the Aedes aegypti mosquito. One time. However, we've seen a resurgence of the Aedes aegypti mosquito and we must understand, it's through a lack of sustained environmental and multi-sectoral action and climate change. And we have, therefore, the proliferation and the emergence of new diseases and the re-emergence of some of those that we have dealt with. We see dengue is now endemic, dengue 1, dengue 2, dengue 3, dengue 4, and has caused loss of life. You know about the chikungunya and now the Zika outbreak. So in a way, what I see now in Aedes aegypti, I see individual countries wanting to say, I want to try the Wolbachia. And one of them is saying, we're going to IAEA. And Jamaica wants to establish a mosquito unit, mosquito prevention unit. That's all good. But countries must not go it alone. We need to go together. Because if Aedes aegypti is eliminated in one country and not eliminated in the others, then that country thinks that it has eliminated, but it will soon see Aedes aegypti present again. So it is this collective effort that must move us to the eradication of the Aedes aegypti mosquito. Over the years, certainly I have witnessed the waning and the waxing of multi-sectoral action for health. I think it received a significant boost following the Alma Ata Declaration of 1978, which highlighted primary health care with the principles of equity, universal access, but the multi-determinants of health. I think that was a very important part of primary health care. It also put all of that within a human rights approach. So through primary health care, through the Alma Ata Declaration, we saw a resurgence of the multi-sectoral approaches, of multi-sectoral action, but importantly, also the involvement of the communities. I think it is this one Caribbean approach. I think that it is this involvement of all of the sectors, all of government and all of the other sectors, private, civil society, that is going to get the Caribbean to successfully confront those challenges that we face now. Challenges wrought by climate, by global climate change, global warming, but some of the significant challenges that we face now. And I probably just want to tell you about the current and future health challenges and where I see the solutions. So I gave you a brief glimpse through a window to some of our past public health challenges and some of the solutions that were implemented based on joint policy formulation and acting as one Caribbean. I would now like to switch gears and focus on the present as well as the future as we look forward to the 2000 Sustainable Development Agenda and advancing One Caribbean, One Health. You heard the mention, I think, the scourge of non-communicable diseases. This region has been in the throes of a major epidemic of chronic non-communicable diseases for the last 30 to 40 years. It is not just now confronting us. It is a long issue. These conditions and their common risk factors are the major causes, have been the major causes of mortality, morbidity, disability, and premature deaths in the Caribbean over the last 30 years. Professor Sir Kenneth Standard would have experienced the rising incidence and prevalence of the NCDs. Ladies and gentlemen, we have a problem. In 2012, NCDs were responsible for 77% of all deaths in the Caribbean, with 40% occurring in persons, 40% of deaths occurring in persons 30 to 69 years of age. In fact, the Caribbean remains the sub-region of the Americas with the highest overall mortality rates of NCDs. We are at 19.3%. The rest of the Americas, including North America, is at 15.6%. With regards to the risk factors, tobacco use, harmful use of alcohol, unhealthy diet, and physical inactivity, recent data indicate that the Caribbean is in poor shape. We relish this deep and long association with alcohol use. It is part of our culture almost. An average 23% of adolescents in the Caribbean currently use tobacco, 23%. And we are witnessing high rates of obesity among children, adolescents, and adults. NCDs also lead to loss in productivity and pose an economic and social burden to families and communities in the region. So deeply concerned with the health, economic, and social impact of NCDs, the CARICOM heads of government convened a historic summit in Port of Spain on this subject in September 2007. So this led to the Port of Spain Declaration uniting to stop the epidemic of chronic NCDs. CARICOM leaders further helped to mobilize global commitments to tackle NCDs, leading to the 2011 UN high-level meeting on the prevention and control of NCDs. So is it, what you say, we're small but we taller? No? Yeah, we're punching way above our weight. With an aim to reduce premature mortality from NCDs by 25% by the year 2025. I think this represents another example of exemplary leadership and joint action of the Caribbean. But I wish I could tell you it was good news, because alas, not much progress has been made in implementing the Port of Spain Declaration. Recently, we did an evaluation report, and that was done by the University of the West Indies, commissioned by PAHO on behalf of CARICOM, and it showed very limited implementation of the declaration. Our governments dropped the ball because a lot of the recommendations, many of the recommendations coming out of that Port of Spain Declaration called for national and joint action to address trade, to address the advertising of alcohol and unhealthy foods. We have done very little. PAHO and the Harvard University conducted a recent study on the economic impact of NCDs in Jamaica and found that NCDs and mental health conditions will lead to a projected economic loss of $17.2 billion during the period 2015 to 2030. This is equivalent to an annual reduction of GDP of 3.9%. We cannot afford NCDs. We cannot afford it because of the societal loss of life, disability, and morbidity, but it is also affecting us economically. These findings strongly suggest that our battle against NCDs and their risk factors will be long and complicated. It is only concerted national action supported by the joint action of the Caribbean as a whole that can successfully address this epidemic. We require the all of society, the all of government, the health in all policies approach. Recently, under my my leadership, we met with the leadership of CARICOM, CAFA, and Sir Georgia Lane, your recent Chancellor and our esteemed Director Emeritus. And we also involved civil society to discuss and commit to the mounting of a one Caribbean-wide public education and awareness building campaign on NCDs. I spoke about the Aedes aegypti mosquito and how we must advance to this response in a collaborative and connected manner. I will skip the amount of dollars that it costs us to every year, but it is significant, significant. In Jamaica, so I'll give you the Jamaica. The CEO of the private sector organization of Jamaica reported more than 13 million man-hours had been lost during the chickpea epidemic, resulting in financial losses in the order of 6 billion Jamaican dollars, or some 60 million US dollars. We need to do something about Aedes aegypti. I want to briefly talk about the challenge of ensuring universal health coverage and universal access to health. Universal access to comprehensive, quality, integrated, people-centered care without exposing persons and their families to financial hardships and environment. This is a challenge for all of our member states, but all of our member states have committed to this. In 2014, they all committed to the resolution that speaks to universal health coverage and universal access to health. This will require that we build resilient health systems, and the emphasis is on resilient, because we need health systems that will not only provide for the full spectrum of health, from health promotion, prevention, right up to palliation, but we need health systems that will stand up in an emergency and will be able to scale up either with emergencies, and we are going to face more and more of the natural disasters related to climate change, but importantly, the emergence of the infectious diseases. In the Ebola in West Africa, their health systems collapsed. They were neither able to deliver their regular services, nor were they able to deal with the Ebola outbreak. We must not let this happen to us. We need to move to a point where we can build health systems that are based on the primary healthcare approach with strong promotion and prevention focus. This too will require joint collaboration and action in several areas. One of them is financing of the health sector. You know, we put out a World Health Report that speaks to financing as the important pathway to universal health coverage. As former British colonies, we knew healthcare as being free and almost guaranteed. Nothing is free, but that's how we perceived it. You went to the doctor, either in your clinic or in the hospital, you got care, thank you. This thinking is still dominating our peoples. Our peoples expect to get health care for free. But the truth is that there is rising costs, and our governments have difficulty in meeting this cost. This cost, as a result, of course, everything is increasing, but there is a heightened demand from the population for more sophisticated care and for access to more sophisticated technology. This constitutes an obstacle to accessing care. What we are seeing is many people are suffering financial hardships, and some of them actually becoming impoverished because they are seeking care. So we need to find a way whereby the financing of healthcare is not only limited to curative care or the financing of tertiary institutions and costly technology, but must be applicable to health across the countries for health promotion, prevention, and palliation. But when you think about it, our small populations, our constrained economies, and our limited financial capacities are inadequate. This should galvanize us to find common, viable, and equitable solutions to the critical issue of healthcare financing. So we've seen numerous initiatives before, and they've been proposed over the years. We've talked about regional health insurance mechanisms covering basic packages of service. We've talked about portability of health insurance and reciprocity. We have talked about the creation of larger financial pools, pulling countries together. We've talked about the creation of hubs and centers of excellence in the Caribbean. And this has only been talk. We've not been able to advance. And individual countries are looking for their individual solutions to financing their healthcare sector. In fact, our governments should be increasing their investments for health, and they are not. Most of our countries, if not all, fall below the 6% of GDP that is required. We must also be able to ensure efficiency. And what you are seeing now in the Caribbean is the building of more and more sophisticated hospitals that countries cannot maintain, that they will never be able to meet the recurring costs. And that is going to shift resources from the first level of care, where most people can receive care that they need, quality care that they need. They are going to shift this to maintaining those huge hospitals that we are building. We are on the path of disaster when it comes to be able to ensure access to health care at a cost that the people can afford at every stage of their development. The same goes for high-cost medicines and technologies. We see with increasing specialization of our doctors and increased access to internet, we are seeing more demand for high-cost technology and high-cost medicines, with no evidence that they increase life significantly. I think the Caribbean must find a way to come together to meet those rising costs and to be able to afford this high-cost medicines and technology. In this regard, we want to recommend the establishment of common formularies, essential medicines list, etc. Find a way of pooling your demands and working through established mechanisms like the PAHO Revolving Fund for Vaccines and Strategic Public Health Supplies. You would be surprised at the savings that governments can realize if they are willing to pool those demands and buy through established mechanisms. I'm not here advocating for you buying through the strategic fund. The volume that comes from the Caribbean is not sufficient to move our costs to any degree. But you would benefit from the larger volumes from the other countries of the Americas. And we are going to have to do this because it is going to be impossible to provide these high-cost medicines. In fact, some of the governments of the Caribbean region signed the agreement to join these purchasing mechanisms. I want to talk now because we can't talk of One Health if I don't talk about antimicrobial resistance. As you are aware, antimicrobial medicines have played an essential role in assuring both human and animal health and welfare. However, the inappropriate use of antimicrobial drugs, both in humans and animals, has become a key determinant of antimicrobial resistance. The misuse of antibiotics and antimicrobials, which includes overprescribing by doctors, the availability of these medications over the counter and on the internet, the lack of regulations in many of our countries. So when you go to get antibiotics, even with a prescription, how are you sure that what you are receiving is quality and it's efficacious and it's safe. You don't know. It is the responsibility of governments to ensure that the regulations are in place and are enforced to ensure that we can get medicines of quality. So this is a problem. We know that in many countries in the Americas, nearly 3/4 of antimicrobial medicines are used in the production of food animals, including aquaculture. They are used most extensively to prevent disease and to promote growth in food animals, a practice that provides favorable conditions for the emergence, spread, and persistence of antimicrobial resistance. We can only confront this challenge as one Caribbean. One Caribbean, and involving all of the sectors, trade and agriculture, animal husbandry, health itself. We need to move beyond the one country response to these major challenges, and let's come together and address this. So we are working with our countries to advance the work on antimicrobial resistance, and we will look to the work jointly with CARICOM University to do this. I just want to talk about some of the advances of One Caribbean in Health, a tribute to functional cooperation, which is an explicit pillar of both the original Treaty of Chaguaramas as well as its revised treaty. So functional cooperation, which is the way that CARICOM pulls its partners and countries together. For health, the CCH, Caribbean Cooperation in Health, has been the instrument since 1995 to bring about this Caribbean integration as far as public health is concerned. And recently, the CCH4 was launched for the period 2016 to 2025. If you are in health and you have not read it, I would suggest that you go online and read it, because there, under the theme of focusing on regional public goods for sustainable health development, we see outlined some of the potential regional public goods which have been highlighted for joint action in the Caribbean. I'm not going to go through them, but certainly they include most of what we've spoken to this morning, this evening. So how do I perceive the role of the University of the West Indies going forward? So as I stand here, when I was a student, if you had asked anybody that I would be standing here talking, they would have said, no, not Carissa. But as I stand here in these hallowed walls of the university, I want to take this opportunity to publicly congratulate the university for its valiant efforts in expanding access to non-campus territories for a university education. However, well as this may be, we must take this further, and particularly where health is concerned, I want to pose a different question. What does the multi-sectoral approach demand of a tertiary training institution such as UWI? From the outside, we perceive you as working in silos. We don't perceive how your different sectors are coming together to address this one common approach, this multi-sectoral action, not just for health, but for sustainable development. I believe that this must be given careful thought and attention. This university is a vital contributor to human resource development in the region. It has contributed significantly to One Caribbean and One Health. So our tertiary training cannot therefore continue to exist in narrow silos. Currently, there is a dearth in health economists. This is the health professional that we are being asked for in great demand, health economists. We require health economists to help us to cost interventions, to cost many of the issues, to help governments with healthcare finances. We believe that the university does not only need to ensure that its training offerings are aligned with changing human resources needs of the Caribbean, but it must also simultaneously assume a leading role in undertaking economic research studies on NCDs, on infectious diseases, to provide the relevant data for informed decision making in health. I want to challenge you. We have health systems approaches. There are significant knowledge gaps as far as health systems. What is the University of West Indies doing to address some of those knowledge gaps in the Caribbean and to do the necessary research so we can best be able to move towards universal access to health? UWI should build a Caribbean repository for health legislation and develop this platform in such a manner as to ensure its future sustainability. Many of the changes that need to occur for NCDs, for universal health coverage, require health legislation. And our member states are there trying, each one of them, to build their own. So we need this health legislation platform. We believe that UE must collaborate with institutions such as the Caribbean Public Health Agency and PAHO to define the new disciplines which will be required to effectively support progress to the achievement of the SDGs. We think that UWI should marshal other institutions and sectors to address the financing of health systems in the Caribbean, including health insurance, increased domestic investment in health, identifying relevant research gaps, and promoting and conducting relevant research where and when appropriate, and in translating, importantly, translating research findings into action. So finally, what do you think Professor Kenneth Standard would have said if he were here today and if he had the opportunity to see the challenges that we face? I believe that he would have highlighted the importance of primary health care. He would have reminded us that an ounce of prevention was worth a pound of care. He would also have underscored the importance of investing appropriately in our health systems in order to ensure their resilience and that our services were efficient, equitable, and people-centered. In his own inimitable style, Sir Kenneth would have emphasized the need for additional training of family physicians, of family nurse practitioners, and indeed all doctors, nurses, and healthcare workers so they could acquire those complementary skills that are required to better promote and advocate for behavior change. He would have stressed the importance of prevention of vaccine-preventable diseases through education, health promotion, and immunization. Sir Kenneth, I believe, would have called on governments to support lifestyle changes to making the healthy choice the easy choice in order to prevent and to reduce the NCDs. He would have also noted the importance of prevention and the need to regulate risk factors such as tobacco, harmful use of alcohol, unhealthy diets, in addition to health promotion. I believe that he would have stood in solidarity with us as we make the case to our country leaders that the short-term financial gains from commerce related to tobacco, alcohol, processed and ultra-processed foods is easily outweighed by the downstream cost of caring for the chronically ill. Dr. Standard, Professor Standard, would have promoted those public health measures required for vector control to reduce the arboviral disease outbreaks, and he might have contemplated with us measures to eradicate the mosquito. Indeed, Sir Kenneth Standard has been an outstanding exemplar for public health. As I close, I would like to challenge each of us to continue to preserve his legacy as we fight in the interests of the health and well-being of our peoples, looking optimistically forward to the era of the 2030 Sustainable Development Agenda, which constitutes a universal call to action to end poverty, protect our planet, ensure that all peoples enjoy peace and prosperity. I thank you for your patience. Thanks.
Thank you very much, Dr. Etienne. That was a brilliant lecture, and we have learned all the things that have been done in the region by PAHO, WHO, and of course, we tap ourselves on the back as University of the West Indies for producing brilliant minds like yourself in the region. We continue as University of the West Indies to try to play our part. We have produced general practitioners, specialists right across the region. And I dare say that we have now produced over 100 doctors for Botswana, or country in South Africa, Southern Africa. They now have their own medical schools, so they have started to depend on us much less. But with the help of PAHO, I'm sure we can train a lot more people from across the world right here at University of West Indies. So thank you very much. I'm going to ask Dr. Edwards now to come and give you a small token.
Dr. Etienne, on behalf of the Faculty of Medical Sciences, I would like to thank you very much for such an informative lecture. Your historical perspective surrounding our theme, One Health, One Caribbean, was indeed very stimulating and eye-opening to some of us who honestly are not so au fait with the fact that we have made such severe strides as a Caribbean people. Of course, from that lecture, we definitely have an interesting conference ahead, and you have started us off on the right foot. Thank you very much.
Thank you so much, Dr. Edwards. Dr. Edwards has been doing this job for a few years, and she has perfected